am Dr. Neva White, and we have a fantastic group for you today. Getting ready for our November the 8th, Saturday, November the 8th event, Victory Over Diabetes. And we have Catherine Schuler. We like to call her Cat. She is a model, and she's also a stylist and an image and style consultant for Divabetic, and she has a host of other organizations that she works for as well. We have Max, Mr. Divabetic Sadak with us today. We have our very own Chef Janetta Frazier, who is our culinary therapist here at Frazier and also our project manager. And we have the one and only Dr. Janine Carrillos. We are so glad that she took time out of her day to be with us. She is a clinical associate professor and director of the Comprehensive Weight Management Program at BALA. So we got a great lineup for you today. We're just going to start talking, folks. So, victory over diabetes, what does it mean? What does that mean?
It's attitude. It's all about attitude and, living with this lifelong condition and how you manage the ups and downs and deal with the unexpected moments in self-care. And I think victory over diabetes means showing your self-love and feeling empowered that you can stay healthy and avoid complications related to mismanaged diabetes.
So, Max, kind of give us, I'm sorry.
I just think victory has the winning attitude towards the approach, because you have diabetes, but it doesn't have you. So we're going to provide some skills and some attitude adjustment tools that will help make it easier for you to approach this with a winner's attitude.
Great. Max, give us a little summary of how you got involved in this fight for diabetes.
I got involved in this fight back in 2003 when I was working for Luther Vandross, and I was his assistant. And I found Luther after he suffered a stroke related to mismanaged type 2 diabetes. At the time, I knew he had diabetes. I knew he was managing it, but I wasn't very empowered to help him. So the struggle he had related, I think, to some of his weight issues, because he was pretty much well known for yo-yo dieting, anywhere from 80 to 100 pounds throughout his lifetime, multiple times. I felt helpless in that moment. And when I brought him into the emergency room, the doctor came out and told me it could have been avoided. And I didn't really know what he meant at that time. And then what happened is Pat LaBelle was at a tribute concert for Luther after he had the stroke. And she said just what Catherine Schuler just said about she has diabetes, but diabetes doesn't have her. And I looked at the stage and saw how outspoken she was about her diabetes and just the way she presented herself in such a proactive way. And that's when the word divabetic popped into my head. And Luther loved divas. And so I thought immediately that being a diva meant that you were creating a self-care entourage of the people around you to help you look and stay as healthy as possible, and that you'd be outspoken about your care in a way that you could ask the silly or stupid questions to your healthcare providers to get the answers you needed for yourself or a loved one in order to stay empowered.
Thanks, Max. Dr. Carrillos, please tell us. I know that as the director of the Comprehensive Weight Management Program at BALA, I'm sure there are so many challenges that you face on a daily basis. Tell us a little bit about your work and your fight.
So I love hearing that the diabetes doesn't have you. I love encouraging people to ask silly questions of their providers, because there's a lot of confusion and misinformation. And, so I'm the director of the weight management program, but, weight has too much weight, so when you asked what does victory over diabetes mean, I was going to say optimizing your health, because you don't have to lose 100 pounds. You don't have to have everything perfect, but what can you do to really optimize your health, to making little changes, I don't look at how much weight you lost, for example. I look at how are you feeling? Are you sleeping better? Are you having less pain? Are you moving? Are you feeling more active? Are your, numbers looking good? Are you able to cut down on medications? There's so many things that we can look at and focus on and help people, um, make little changes that really, make big victories.
Okay. Catherine,
Yeah.
let's talk about this whole idea of fashion and image. And can you be beautiful at any size?
Absolutely. And you need to know what shape you are. That's the thing. It's not about, you ask a plus size woman, because I'm a plus size model. I was in the field for many, many years. And, we have a lot of body dysmorphia, and 86% of women living with diabetes are plus size. It's not just a thin person's, it's not just a plus size person's uh, um, uh, situation. I mean, it's everybody. So I think everyone needs to know what clothing looks best on them, because I believe in having a divitude every day. Every day you go out there and you face the world. That world is your runway. That the streets are your runway, and people judge you harshly, they judge you favorably, and they treat you the way you appear, because you have to look like you care. And if you look like you care, you will get more feedback and more positivity. When I had a stroke, I know I dressed up every day for rehab, and I was one of the only ones who did that. My makeup and my jogging suit. I had a jogging suit that I wore was matched, and when I was checking out of the hospital, they asked me to be in the annual report. So I was a model in the annual report for the stroke award, and I was like, oh my god! That, of course, they said, we know you can do your makeup. So you have of all the things that are happening in the world and in your life, the one thing you can control is the way you appear, and the way you behave, and the way you communicate and express yourself with your clothing. So I have a program I created called Shape Shopping. It's called that because it's figure out your figure type and then what your fit is. So figure and fit is what I do, and I'm going to be giving everyone one of these wheels. That's a wheel chart, and it helps you figure out your figure types. So there's waists and waist knots, and you are one of those categories or a hybrid of them. And because the women are right in front of me, I can help them figure out their figure type. So you open the chart and you see the body's divided from bust to waist, waist to hips, and bust to hips. And you figure out what your figure type is. An icon comes up in the windows. You figure out what your figure type is, and then what your fit instructions are, what mantras you have to pay attention to when you're shopping or when you're putting clothes on. And it does make a difference. There are better and best and exceptional choices, and it's not just about size, it's about style. So you can look good at a 2 and you can look good at a 22, and it's all about getting that proportion and that balance, the placement of the patterns, and the way the fit is on your body, that really helps you to control that appearance that you have in the way the world, and you just feel better too. When you look in the mirror, you have a great outfit on, it changes the way you feel. It empowers you. And that's what we're about, using all the tools in your toolkit to get that empowerment and on board. And we're going to have a great program. I'm calling it Successorize. Don't wait, WEIGHT, to look good, to look great. Don't wait to look great. So Successorize, don't wait to look great. So you can do this today. And we're going to have transitional wardrobing so that you can have a wardrobe that goes down a few sizes. So every day you can look good. And there are pieces in your wardrobe that'll be capsule, and we can identify those for each body type, and people will walk away with some knowledge and empowerment, and they can apply that to their wardrobe so that they have a repertoire of reliables that they can then pull every day and keep on track because when you're on track, when you know who you are and you know what you want, you do better, you look better, you do better. And that's pretty much what I'm going to be talking about with the image and style.
Fantastic. Let's bring we're gonna bring Chef in here. So Chef Frazier, we know at the Frazier Family Coalition that you are the plant forward thinker. So tell us about what's this whole culinary therapy thing and what will be some of the things you'll be doing at the Victory Over Diabetes event.
I go with, excuse me, the plant forward approach, eating more fruits and vegetables every single day. That's what's lacking in the American diet. Fruits and vegetables. We rather go with the meats and the snacky foods, the things that are full of fat and sugar and salt. But plant forward. Get fresh fruits and vegetables every day. Remember, we used to say 5 a day. I like to say 9 a day. Let's eat at least 3 fruits a day and 6 vegetables. If you eat a salad every single day, you can easily get those 6 vegetables in there. And I'm talking about, the green, leafy, non-starchy vegetables. I'm not talking about the potatoes. I'm not talking about the corn. So get the broccoli and the bok choy and the asparagus and the green beans. Those are great things to eat. All right, so let me move on to talk about this culinary therapy. Like, what is it? So, culinary therapy is a food and cooking approach to deal with emotional and psychological problems. And you're like, what? Do I have to sit on a bed and tell you all my issues that I've been having since I was age 2? No, it's not that. It's using food and cooking to deal with things such as mindfulness, helping you to focus. It helps you to deal with things like time management, communicating with other people. You do hands on activities. So, when you do hands on activities, you get to feel and touch to see what's happening. When you're kneading bread, everybody's kneaded bread, or you've seen
Mm-hmm,
people knead
mm-hmm.
bread. So, if you have any aggression, any anger, any stress, take it out on that dough. How about that?
I love
It's
it.
an
I
opportunity when
love
you
it.
get to not just only touch, but to smell and to see those different fruits and vegetables that are out there. Besides that, it's all about time management. When you're cooking a recipe, you have to do it in a certain amount of time, right? If you take too long, your family's going to be angry, right? So you need to do things in a timely manner. And it's all about getting it done. So you have to complete the recipe to get the end result, right? You can't stop right in the
That's
middle.
right.
You have to do the
That's
whole thing. So that's about success, how you can have success in your life. And finally, it's about relationship building. So when you create a recipe, sometimes you create recipes, not create, but make recipes with other people. So that's time where you can talk to the people that are helping you make the recipe. How do they feel? How do how are you doing this together? How can we be successful? And if you're having problems, talk through these problems that you're having when you're making these recipes. And those problems can ultimately relate to your real life experiences. So that's culinary therapy.
That's it. So, Max, tell us all about Victory Over Diabetes, Diabetes Wellness with a Wow. What's this event all about?
Well, see, I think people are going to look at this and think it's just going to be a lecture, and it won't be just a lecture. It's always going to be a good time. I can't help but realize like this month is about what they do for breast cancer, and I love how they celebrate people. And that's the attitude we like to bring to our events, working together to like lift people up. And if people are listening today, it's like we know over the 20 years of doing outreach that people feel very lost and confused, and sometimes they wake up and they're not sure how they got to this place. And so today when we get together on Saturday, November 8th, we're going to tackle probably one of the biggest issues around the stigma of living with diabetes and the shame and blame. Maybe you're just not comfortable in your body, and so being mindful talking about these new drugs that we're hearing about all the time with celebrities and getting a little clarity with that, and walking away with what Catherine was talking about that boost of confidence, about feeling good about yourself right now in order to kind of renew your spirit, feel re-energized, and to take charge of your health again. And I think that's what it is. It's about having community support. It's about having great resources like with the Frazier Family Coalition. It's about hearing testimonials from other stroke survivors like Catherine Schuler, who could tell you what the struggle was like before she got to the success. And it's about connecting with experts and learning about what's available today with weight management. What could your options be? And with all that, Neva, it's about the razzle dazzle. We'll have chair yoga. We're going to do some line dancing. We don't just like to sit down. We like to really get people up and moving, and just, taking these challenges on today requires even more energy than ever before, and it requires a community to get behind you. And I want people to know that that's what we're trying to do on Saturday, November 8th, is to bring the community spirit, and to just, every day that we don't hear Luther Vandross singing live empowers me to want to get out there and make sure that people could lift their voice in victory and stay alive for their friends and their family during the holidays, and renew their spirit around their health.
Yes. So Dr. Carrillos, we're so excited about your presentation on November the 8th, weight loss, tools, tips, and testimonies. I mean, so, at a comprehensive weight management program, what can I hope to gain or experience if I call you and say I want to come in and see you?
Comprehensive evaluation of every patient. We go into lifestyle, sleep, stress, activity, movement. So which really incorporates a lot of what all of you talked about in terms of positive health. What are you eating? How are your social connections? How is your sleep and stress? But then we also talk about medications, and what are some medication options that might be available to you, whether you have diabetes or you don't, or you've had a stroke before. There's some of these medications have new indications. So one of the medications, may not be covered for weight loss, but it's covered if you've had a stroke before. So, different ways. And I might even take cues from you in the audience. Like, do people want to talk about how to pay for these medications? What the ins and outs of prior authorization and insurance and the different names of them. It's so confusing. Like, Ozempic, Wegovy, Rybelsus, it's all the exact same medication, but one's approved for diabetes, one's approved for obesity. How do you know which is which? There's a lot of, and then some patients will refer for surgery. There's patients that do well with bariatric surgery, can be game changing. In the end, treatment of obesity and diabetes, it's not one thing. It's all of these things. It's all of these lifestyle changes. It's maybe several medications or one or none. It's maybe surgery, and it's maybe you do all three together. So those are the things I'll kind of give a good overview at our great Victory Over Diabetes celebration, and some of the things you could expect if you come to our program.
Great. So I'm just going to run through the program and what everyone should expect. So the program is taking place in Philadelphia at Thomas Jefferson University. It's going to be located in Jefferson Alumni Hall, which is 1020 Locust Street. And it is Saturday, November the 8th from 10 a.m. to 1 p.m. You can go to our website, FrazierFamilyCoalition.org, to get more information. It is a free event. Get more information and, of course, to register. So we'll have, holiday fashion. I love this, Kat. I love it. Holiday fashion crisis intervention. Can you just give us a little tiny snippet of what we're going to look for with that real quick?
Well, like I said, you're going to have those repertoire of reliables. We're going to look for things that are in your wardrobe that you can turn to, and how to change those up. Because obviously, if you are going through a weight loss or if you are, looking for something to spice it up, how do you spice up with accessories to accessorize your look and really vary it? I usually wear a lot of basics, and then I use what I call power pieces over them, which are statement pieces, things like that you can add to your wardrobe that change it up completely. And you can do that multiple times, and throughout the holidays you don't want to show up in the same thing twice, please. So how you can have something in your wardrobe that you can turn to and change it up. I have a bunch of ideas, and they're very simple to, everyone thinks it's, some, a mystery how to, we're going to debunk a lot of myths that you can't look good. You don't have that image gene. You don't have the wardrobe capability of putting yourself together. I teach, I keep it very simple, but very, very direct and very user friendly, so that they know how to go home and do that for themselves. So I'm trying to think of some exercises maybe that they can do when they get home, when they look at their wardrobe and pull some pieces out, and teach them how to work those in a way that changes it up, and add some bling, and add some vitality to their wardrobe, so that it's not just same old, because the holidays are coming. You gotta dress the part.
Exactly. All right, guys. Well, we're going to go around and give everybody some last words. And let's start with you, Max.
All right. Well, we heard it today. I think we all know that people don't have that much time in their doctor's appointments to really have these conversations. So I think they're going to have this chance again to hear more information about what's going on with weight loss drugs and medications out there. Plus, they're going to get the boost of confidence. Plus, they're going to meet the community. And, I like to play games. I've got prizes and giveaways. You're going to have a good time with us. I hope you join us for Victory Over Diabetes.
Great. Dr. Carrillos, you want to give us some final words?
Gosh, I have so many. I want to reach out to everybody. One thing that we approach everybody is the best they can with the tools they have. So we want to give you some new tools. We want to help you understand what tools are available. And I know everybody's dying to hear about the weight loss meds and what the celebrities are taking and what maybe not be a good idea. You don't want to be getting it from, a med spa where you might not know what you're getting. So I'll help you understand all of that. Help you understand what to ask your doctor, your provider, so that you can really be empowered to move forward with this.
Great. Catherine Schuler.
Yeah, I can't wait to do this. I love fashion, just excites everybody, and I think it's really the thing I love about working with Divabetic is how it's not your grandmother's diabetes. You're not going to get admonished. You're not going to get finger wagged. You're going to get real tools to make you look fabulous every day and glamorize good health.
Fantastic. And last but not least is Chef Frazier, who always has some words of wisdom for us.
All right. So my words of wisdom are: food is medicine on all levels.
Fantastic, everyone. So there will be more. I will be calling on you guys to come back and talk more about our victory over diabetes, the challenges and the things that we know and the things that we do. So I just want to thank everybody for being together today, and we're looking forward to our event on November the 8th. Take care, everyone.
Very excited.
Bye. See you soon.
Bye.